once again, it's a pleasure and honor to talk to you. I know I got to talk to you about a year ago on the HBO podcast, and so we kind of shifted formats a little bit. So you're in a group of a bunch of meat eating people that are obviously low carb ketogenic backgrounds, and so I'm going to let you kind of introduce yourself a little bit, but just as an overview, I know you are a psychiatrist practicing at Harvard University, which some people have a negative connotation depending on what you believe, but you're kind of a good guy from, I think if I recall, from Indiana, if I'm not mistaken, but correct me if I'm wrong.
I am.
Yeah, and I spent a lot of time in Indiana when I was growing up, but you're doing some really interesting work looking at diet, particularly low-carb ketogenic diets, in the realm of how it affects mental health. So with that, if you could spend a moment introducing yourself a little more formally, and then we can get into some interesting, fun stuff.
Sure. Yeah, no. So I've been doing the work, with low carb and ketogenic diets for, about 20 years. And I got into it just for my own personal health. I was on a low-fat diet and exercising and doing everything I was supposed to do, and that didn't work out well. So I ended up adopting a low-carb ketogenic lifestyle for myself and have been on it for 23 years now. And noticed significant improvement in my mood. I wasn't clinically depressed. I was functioning. I had a good job. I did everything I did, but I noticed a huge difference in my mood, motivation, sleep, all sorts of other things, and started using it in patients that I had with treatment-resistant illness. And then probably about 4 or 5 years ago, I had a patient with schizophrenia who wanted to lose weight, and put him on a ketogenic diet just to help him lose weight. Wasn't expecting anything more than that. Wasn't even sure if he'd be able to lose weight. And lo and behold, a lot of his psychotic symptoms, which had been chronic, treatment resistant, he was on tons of meds. All of those things started getting dramatically better in a profound way, so that he was able to function in a very different way in the world, and was able to move out of his father's home, was able to start taking classes, all sorts of stuff. And that's really what propelled me to kind of start doing a lot more work and publishing on this and writing on it and doing all that. So I'll stop there. I could talk forever.
Well, and that's great. Hopefully we'll talk in depth. But I mean, one of the things, you said you've been on a low carb ketogenic diet for 23 years. We have all these people saying, well, it's an unsustainable diet. No one can do it more than 6 months. So obviously, there's thousands upon thousands of people have been doing it for many, many years, decades even. And so this unsustainable sort of thing is, I think, largely kind of BS. And it's interesting that, and I find this a lot among physicians, because we're kind of brought up to think a certain way, and it's not till our own health. We practice things for years telling people to do stuff, and you're asked about, well, would you do that to yourself? And your answer is probably maybe no, I wouldn't. I know there was a survey in orthopedic surgeons talking about, I think it was Achilles tendon ruptures, and said, would you have it surgically repaired or leave it or not repair it? And a large percentage of surgeons said, no, I would not have it surgically repaired. I treat it conservatively. Yet they would offer the surgical option to the majority of their patients, which I thought is just kind of funny how we kind of become very, where there's a double standard when it comes to our own health versus what we're willing to do to our patients. So, and it's really interesting that most physicians, until their own health suffers, and a lot of times it's as we get older, we notice that we fail to sort of really look into things like nutrition. And once we do, we just can't, you can't unsee it. Like, I know a lot of people say, once you see it, you can't unsee it. And so, and you've got this compelling anecdote, which, probably there wasn't a lot of literature at the time. There's probably more coming in now, or you started to read the literature, but that's exciting stuff, because we've got just a huge group of different anecdotes of people that are compelling more stuff going on. So let's talk about, because I talked to you about a year ago. What are you up to lately? What things are you studying currently? What are you finding out? Has the evidence sort of convinced you more as you go that there's something here? And what are some of the mechanistic things you're working at? And do we have an idea why things seem to help, or are they truly helping?
Yeah, no, all great questions. And I'll try to be concise, because like I said, I could talk on that for probably 5 hours. But so I have been continuing to do this work. So I mentioned that one patient that, again, I've been using this for over 15 years with patients with treatment-resistant depression. I never really felt compelled to publish it because it seemed too fringe. You know, a ketogenic diet for depression, nobody's going to believe it. They're all going to think I'm a quack. I got a good job. I want to keep it. I'm not going to publish it. It's not, you know, that we have treatments for depression. When I saw it work for schizophrenia, that kind of, in many ways, turned my world upside down, because I really would have completely not believed that a ketogenic diet could transform the symptoms of schizophrenia. I mean, those are, you know, hallucinations, delusions, people can't think straight, they're not able to function in the world. I mean, these are the people that you see homeless on the street, you know, mumbling to themselves. They haven't showered in, you know, months. That's what this illness is. And so to think that a diet could like make their brain normal again was kind of unheard of at the time. There were 2 published human case reports or small studies at the time that I just wasn't aware of, that I have since found out. Since then, I've been using this treatment in dozens of patients, and I'm actually contacted by people all over the world, almost on a daily basis, unfortunately. So I'm turning people away right and left. So I'm doing this a lot. And what I can say is this: it absolutely works in really profound ways for some people. I can also say this, to be honest, it doesn't work for everyone, unfortunately. I wish it did. I wish it was like the magic bullet that would cure everyone of everything that they have. And at least in my hands so far, it doesn't seem to cure everyone. And we know from the epilepsy literature, you know, this is a treatment, ketogenic diet was developed by a physician to treat epilepsy. And we know in the epilepsy literature even that it definitely can work for a lot of people and work really well. But unfortunately, it doesn't work for everybody. And we still don't know exactly why. They may have a different type of a problem, maybe a different type of metabolic defect. So a lot of this revolves around metabolism, and especially brain metabolism, and what we think are metabolic abnormalities in the brain. And one clear example of why a ketogenic diet might not work for somebody with a metabolic problem in the brain is some people actually have metabolic problems processing fat, that they actually don't have the normal enzymes or other things that they need to process fat as a fuel source. So that would be a person that would be an example where the ketogenic diet actually might make them worse, because they're already limited in how they process fat. And so I think that at the end of the day, psychiatric disorders and a lot of health conditions are complicated. It's not like there's one problem and one treatment that's going to fix everybody. Again, as a physician, I wish it was that simple, but it's not. But it's helping a lot of people. And more importantly, it's kind of calling a new question, like, what is this role between metabolism and diet and what we call mental illness? Because most people aren't talking about it or thinking about it in that way. And I can say this, the really exciting thing to me is that since I've started doing this work and since I've been speaking, there are about 5 or 6 like really major leader psychiatry researchers in the world. They're in like the top 10 or 20 researchers who are currently alive, who are basically all over this. One of them kind of stole the idea, forgot to mention all the other work that I and others have done. So I call that academic competition, but I think that's great because they obviously think it's a brilliant idea and they want credit for it. So I'm like, great, then you're gonna help other people. So go for it, go ahead and steal the idea. I really kind of don't care, just let's help people. Let's like get a treatment that actually helps them. And so a lot of researchers are really interested in this. There are a few trials getting underway. One of the biggest concerns that I have about those trials is that a lot of these researchers, they're scientists, and they understand the science of why this probably will help some people with mental disorders. The problem is they don't know shit about the ketogenic diet or carnivore diet or low carb diet. And they have no idea how to get people to do these diets. They think it's as simple as I'm going to give you a pamphlet and then there you're all set and you're like going to go do everything that you need to do and come back to me in 2 months and you're going to be cured. I'm like, well, it ain't that, I wish it was that simple. It ain't that simple. Sometimes people need a lot of education. They need coaching. They need help with like, how do you resist, you know, when you're at your families around the holidays and they're all eating stuff that you really love. How are you going to get through that? What are you going to do? Can you still have friends? Can you still go out to dinner? Because you see them eating bread that's tempting you, or you see them eating other stuff. And so it's more than, you know, it's more than just giving people instructions on here's the diet you're going to follow. I think people need a lot of, like I said, education and support and coaching. And so when it comes from somebody who's kind of doing it and living it, like for me, I get it. That's why I can get so many people to do the diet, because I know it. And I can also be patient and understanding and be like, okay, you had the bread. Well, let's get back on the wagon. It's all right. You don't have to be perfect in the first month or so. It's like, it's okay. And then we just, you know, we work with them. So I think it's a really exciting time to be in this space. And I'm really hopeful that we can get kind of competent researchers who know how to get people to do this diet to actually participate in the research so that we can see some studies. You know, I'll give one example. So Johns Hopkins, they're really good at getting people to do the diet for epilepsy, but when they do it for epilepsy, they're talking to parents who are desperate to get their kids' seizures to stop. And those parents will do anything. They will bust their asses night and day to make sure the kid does this ketogenic diet to stop their seizures. When Johns Hopkins tried to do a study of the ketogenic diet for Alzheimer's disease, the end of the day, after 2 years, they only got 14 people out of over 1,000 people that they screened and tried to recruit. They only got 14 people to participate and actually do the diet. And they finally just gave up. And so interestingly, of the people who were able to do the diet, they actually had cognitive improvement within 6 weeks, which is unheard of in Alzheimer's disease. So they saw a signal, and they saw this might actually be an effective treatment to possibly help treat some of the symptoms of Alzheimer's, or maybe slow the progression of Alzheimer's. Maybe for people earlier in the course, we might even be able to prevent it. So there's a lot of hardcore science that backs that up. But at the end of the day, when the rubber meets the road, you got to get real human beings to do this treatment. And they weren't able to do that. So I'm a little worried that sometimes the research is going to come out and with that kind of a conclusion that just says, we don't know how to get people to do this diet. So that's where I think people like you and probably everybody on this webinar can help, because you guys know how to do this. You guys know how to motivate people, educate people, coach them, get them through it. And so I think the more that we can get people to participate who know this diet and who know how to get people to do it, the sooner we can start mainstreaming this treatment. I'll stop there.
Yeah, no, I mean, and that's great. And that certainly buys in. And I think that the support aspect, and it's one of the things that we're trying to do with this community. We have people that have been through it, done it, then they become coaches. We have meetings. We have several mental health meetings a week in this community where people go and they're dealing with those issues. And it is a lot of that. You're right. There is a struggle. There is a, how do I avoid this? How do I make it palatable? How do I sustain it? And so there is a definite need to, you can, like I said, you can write on a piece of paper what to do. I wrote a book on how to do this diet. Still, there's people that have questions and they're figuring out how to do this. But so the support aspect is very interesting. I'm interested to see, if we think about theoretically, and there may be more than theory, maybe there's some actually hard science on what is going on in the metabolism of the brain or the biochemistry of the brain. And is there some associative things that kind of predict success? Like if you say you've got somebody that, for instance, let's say, I'm just going to throw it out there. Somebody is, pretty insulin resistant or maybe even obese. And we know that maybe that phenotype or that sort of the background may predict a better success when you alter diet versus someone who maybe isn't suffering from those things. Do you see a correlation there? Or what has been your gut feeling on this person likely will improve, this person maybe kind of a coin flip?
So it's a great question. And unfortunately, the answer to that second part of your question, like, can I look at somebody and accurately predict whether they might respond or not? I actually can't. And one of the reasons is that we actually do have really good science on this. So when people have, especially this more serious psychiatric disorders like bipolar disorder, schizophrenia, but also chronic depression, and those three disorders in particular. So not people who just get depressed for like a month after breaking up with, a significant other. We're talking people who have chronic, lifelong or years-long depression. That and bipolar disorder and schizophrenia all seem to be on a continuum. And they probably have a lot of similarities in terms of their illness and the biomarkers that we see in their brains and in their bodies. And some of those biomarkers relate to things like inflammation, low-grade inflammation, oxidative stress, which is kind of, stress metabolism, but insulin resistance seems to play a role in these people. And the really confusing thing is that in people with mental disorders, they can be insulin resistant even though they're thin. And some of them are actually hardcore athletes. So they could be a hardcore athlete, really athletic, competitive, and come in with new onset psychotic symptoms or manic symptoms or severe depression, just out of the blue, no clear reason. Researchers have been studying those people even before we give them any medication. And already we can measure levels of insulin resistance in their bodies and their brains. They don't yet meet criteria for diabetes, so their blood sugars aren't high enough for them to have diabetes, but they already seem to have insulin resistance in their brain. And so looking at them outwardly, you would think, well, he's an athlete. He should be good. He doesn't need a diet, especially a ketogenic diet or carnivore diet or whatever. Why would he need that? He looks fit. He doesn't need to lose weight. Yet if he has psychotic symptoms or severe mood symptoms, he actually might, because it might be going on in his brain. And so the goal of the diet for that kind of a person isn't really to help them lose weight. The goal is to get a different fuel source into their brain and try to correct those metabolic abnormalities in their brain. I can't under understress how much research there is on this. One of the people who's leading this charge, at least in the addiction world, so she's proven this she kind of proved it for obesity and junk food addiction. She's one of the researchers who really started that movement, and then she's an addiction researcher, so she's doing research on this for alcoholism and other substance use disorders. Her name is Nora Volkow, and she's the head of the National Institute of Drug Abuse. She is like a world-renowned researcher, and she has identified that these people have glucose hypometabolism, is what it's called, but basically their brains aren't using glucose in the same way that other people's brains are using glucose. And so their brain cells aren't getting enough energy. It's that plain and simple. Their brain cells aren't getting enough energy. When they don't get enough energy, they don't work right. It's really that simple. So somehow we have to get them working right. And one of the ways to get them working right is to, number one, provide an alternate source of fuel, which could be ketones. But the other way to maybe help restore their health would be to override this insulin resistance, that if we can somehow address it in a longer term way, they might even be able to go back to a quote unquote normal diet and be okay, at least some of the time. I think if they go back to a diet high in junk food and start gaining a ton of weight, the insulin resistance will come right back immediately. But I don't know that they need to be in ketosis necessarily forever and ever. It may be that they're in ketosis for a couple of years to try to overcome their insulin resistance, and then they can go on some other kind of a diet that maybe is a little less strict. But I mean, that's one theory. So, you know, glucose hypometabolism, inflammation, oxidative stress. We know that all those things are related to imbalanced neurotransmitters. So that's kind of the big theory right now. It's all these are chemical imbalances in the brain, and the chemicals are the neurotransmitters in the brain. But we know when people have those things, glucose hypometabolism, oxidative stress, their neurotransmitters actually get imbalanced because those brain cells aren't working right. So it doesn't prove the chemical imbalance theory wrong. It actually, in many ways, supports the chemical imbalance theory, but it offers a very different way to rebalance those chemicals. Instead of giving them psychiatric drugs, we rebalance those chemicals by restoring normal brain metabolism. And then finally, I'll just mention the gut microbiome. So that's a huge topic. Everybody's talking about the gut microbiome. There's a fair amount of evidence that the gut microbiome probably plays a role in a lot of mental disorders as well as metabolic disorders like obesity and cardiovascular disease and all that. And we know that anytime you drastically change your diet, you're changing your gut microbiome. But we have reason to believe that ketogenic low carbohydrate diets tend to result in improvements in the gut microbiome that confer metabolic health. So, and we don't know exactly what that is, like why that is. There are trillions of microbes in your gut. So like nobody knows for sure, like, well, which bacteria is it? Or what are they doing with, you know, but that can help us understand for some people, for instance, why some people may not do well with plant foods at all, because plant foods have fiber more often than not. And who knows what your gut microbiome is doing with that fiber? Maybe you have a different gut microbiome. And somebody who's vegetarian, who's saying that they're really healthy and appears really healthy, maybe they don't have that gut microbiome, so they can tolerate plants. But other people have a different gut microbiome, and their microbiome can't tolerate plants. It's actually toxic for them. And so I think sometimes we just have to use common sense too, and just like, you know, if somebody's saying that I'm a lot healthier on the diet I'm doing, I usually try not to argue with them. I'm like, okay, great. And, you know, I look for objective evidence, like, is your blood pressure actually normal? Is your weight reasonably okay? Is your brain functioning okay? And, you know, if I check all of those things off and they really are reasonably healthy on whatever diet they're doing, I'm usually like, great, good for you.
Let me and this is all one great information. I agree with you about the gut microbiome. I think we're very premature in prescribing what the ideal microbiome is. I think we're just so far away from being able to do that. It's so incredibly complex. I think people that attempt to do that are kind of really stretching things. But let me ask you about, because you talked about glucose hypometabolism in the brain structure. So I assume, I guess you could perhaps maybe PET scans or something like that would help you visualize that, I suppose. And then what about the role of exogenous ketones? I know guys like Dale Brett is doing some Alzheimer's research. Do you think it's the ketones themselves that have this magical property, or is it just the milieu of the entire environment, which I think it's, if we go on a ketogenic diet, we're changing more than just, it's not just we're making ketones in a higher concentration. There's a lot of other things that are probably happening. So what is your thought on the use of exogenous ketones? And can we look at our brain and say, hey, you're not metabolizing glucose well? How do we determine that?
Yeah, no, it's a great question. And it's one that I've, at least kind of experimented with some of my patients, just who maybe aren't doing quite well. So the one thing that I'll say is that, at least in my experience, I have not seen anybody who significantly benefits from exogenous ketones alone without doing at least a low carb, if not ketogenic diet. That there is something about bringing insulin levels down and bringing glucose levels down that's really important. There's also something about, again, changing the gut microbiome. We don't know exactly what it's doing, but we know that when you change your diet in specific ways, that you are changing your gut microbiome, and that those microbes are then doing all sorts of stuff that we don't really fully understand. So I've had several patients who've tried exogenous ketones on their own, and they really don't do much of anything for them. However, there's one there's one kind of way that I sometimes do use exogenous ketones. So I've had some patients, especially patients who are already on psychiatric meds. So a lot of the psychiatric meds actually raise your glucose levels and raise your insulin levels. So it's kind of a double whammy. Not only is your illness doing that to you, but the medication, the treatment for it is also doing it to you. Kind of like we see with diabetes. Somebody's got diabetes, they've already got insulin resistance. So what are we going to do? We're going to put them on insulin and make them even more insulin resistant, make their insulin levels even higher. Or we're going to put them on oral medications, many of which cause more weight gain, which causes even more insulin resistance. So it's a similar scenario. So I've had some patients like that who really have a hard time getting high levels of ketones, I think because the meds they're on are preventing them. Unfortunately, sometimes we try to get them off their meds, and then they actually get a lot worse when we try to take them off, or if we try to take them off too fast, because some of these people have been on these meds for years or decades. And so their brain has made a lot of adaptations to them. And so it's really dangerous for them to try to come off too fast. So they're stuck on their meds for now, or at least, we're going to do a slow taper over a period of sometimes years, but they're stuck on at least some of those meds for now. And so they really have trouble getting ketone levels high, I think because of the meds. And I've had some of those patients who've tried exogenous ketones, and we do see a boost in their ketone levels. And some of them have actually had pretty significant benefits from that. That, that they were somewhat improved on the ketogenic diet with their meds while we're still trying to get them off their meds. But then when they added a ketone supplement, they actually got dramatically better, sometimes within hours. I know that there are some researchers looking at exogenous ketones for Alzheimer's disease as well. Some people are really interested in it. Again, at least in the limited experience that I've had clinically, I suspect you actually probably have to do both. You have to do at least some kind of a dietary intervention. You can't be eating donuts and, cereal and bread and everything else, and just taking exogenous ketones, hoping that that's going to do much. I'm not hopeful that that's going to work out, but there are people doing the research trying to figure out maybe it will. And it would be nice if it was that easy. I don't think it's going to be.
Yeah, I tend to concur. I don't think that's a solution. I think that's a side effect of the things you're doing correctly and eliminating all the, things we're probably not well designed to eat, or at least many of us aren't well designed to eat, and other lifestyle things as well. What, I guess one of the things that this is kind of a new sort of paradigm for a lot of physicians is deep prescribing, because, you go to medical school and they teach you how to put people on meds, but they don't really teach you much about taking people off medication. There's some we know that you can't rapidly take off or people get really, really sick, but how difficult was it for you to start figuring out how do I get people off these meds once you made those dietary interventions? Has that been a challenge at all?
So it's really interesting because even though I am a psychiatrist at Harvard and, I direct a lot of their educational efforts and stuff. So in many ways, I'm kind of a traditional psychiatrist, for 25 years, I've been pretty much a rebel in terms of medications. And so I definitely prescribe medications and I've seen them work and I know they work for some people. But like any medical treatment, I also think they can sometimes make people profoundly worse. And I think we have to acknowledge that even if some people benefit from it, some people are harmed by them. And, and I've seen that a number of times. People come in to me with what's fairly simple bread and butter depression. They go on an antidepressant, and then within 2 months, they're now bipolar, and they're getting, they're suicidal, they're getting agitated, they're like having these episodes where they go on rage attacks and destroy a house, and it's kind of like, gosh, did anybody stop to think maybe the med is playing a role in that? Because they weren't like that before they started this medicine. I mean, it's not that they didn't have a problem. They clearly had a problem. They were depressed and seeking treatment, but maybe the treatment actually ended up messing them up and making them so much worse. So I've been onto that for a couple of decades. And I have been pretty committed to always seriously looking at all of my patients and always critically asking myself, are they benefiting from this treatment, or is the treatment actually causing the problems? And I can tell you, even without the ketogenic diet, I've had a number of patients that I have simply, all I did was get them off their meds. For some of them, it took like 3 or 4 years because it was painful. Every time we went down even a tiny bit, they would get worse. They would get suicidal. They would cut themselves. They would do something that made it dangerous. But we went slowly enough and got them off their meds. I almost always added exercise for those people. I really pushed vigorous exercise, not taking a walk around the block. I'm like, you can start with that if that's all you can do, but I need you to sweat and I need you to really be huffing and puffing. You've got to be doing some intense cardio or, weightlifting or something. You've got to be doing something. And I usually just say, do it all. You fit in some cardio and some, weightlifting and other things. But so I've had a number of patients that achieved full remission. They were disabled by psychiatric symptoms for 20 years. All I did for them was get them off their meds and get them exercising. And for some of them, that was enough. And they are in full remission. Just ran into one of them not too long ago. It's like 15 years now. She's been in full remission. And she was a psychiatric nightmare. I mean, she was in and out of hospitals, trying to kill herself at least every 2 months or so. Her parents were beside themselves. They didn't know what the hell to do. I saw her father, who's a physician, and he's like, you saved her life. And what you did is you got her off all that shit and you got her exercising, and she's great now. She's been great for 15 years. So when I see people improve with the ketogenic diet, almost always, they usually are coming to me and wanting the ketogenic diet because meds have not worked for them. So almost always, I'm at least raising the question with them, are you willing to try to get off these meds? It's a process. I really can't overstate this. It is a dangerous and difficult process. And people have to be willing to suffer, unfortunately. I'm like, I wish I could just put you in a coma and get you off everything and you'd wake up all happy, but the human body doesn't work that way. And the human brain definitely doesn't work that way. And your brain is adapted to these medications for, sometimes 20, 30, whatever, 40 years. And we've got to wean you off this stuff now. And it may be really uncomfortable and unpleasant, and you might get more symptoms as we do that. but I really think that can be a path to like true health and like real success. And it's interesting because the majority of people who are doing dietary interventions, whether it's keto, low carb, carnivore, whatever, the majority of people that I know who really seem to have conquered their illness, they all had to get off their meds. I don't know many of them that are still taking their meds. I think the diet can help a lot. And so sometimes people get, 60% improvement, which is better than nothing. But if they really want to completely restore their health, we usually have to get them off all their meds. It's kind of like reversing diabetes. If you want to really reverse diabetes, you got to get off the meds. So, and that's a difficult process. But we got to start with the diet, get your blood sugars down to a reasonable level, and then slowly but surely try to wean you off some of the meds. And we got to do it safely to make sure that, your blood sugars don't go crazy too high or crazy too low. So we got to do it in a responsible way. But so that's kind of my approach right now. And you're right. Most physicians aren't trained. We're all taught that meds are good. Meds are treatments. They're FDA approved. What's not to love about them? So if people are on them, they can't be doing harm. Why would they do harm? They're supposed to be good for you. I actually think we need treatment centers, especially for psychiatric patients who've been on meds like I see for years or decades. I feel like we need treatment centers where they can kind of check themselves in, take a few months to be more aggressive about getting them off. Because it's just really unpleasant, and you need to keep people safe while you're doing that. Like, we can't have them trying to kill themselves and other things. So we got to do it in a safe way. But if we check them into some kind of a residential treatment program or something, they could do that for them. We could help them. We could basically detox them. It's kind of like an alcohol detox. We could detox them and teach them how to do the diet, teach them everything else they need to know, get them exercising. And at the same time, detox them from all the meds.
Yeah, one of the things, and I see very commonly, you kind of touched on this earlier, is addictions. And, we do, and I know, I guess my understanding is there are people that have actually been medicated into basically a coma under the direction of an anesthesiologist for 24, 48, 72 hours while they detox off of heroin or some other nasty, drug addiction, like some celebrities might do that. Obviously, that's not practical for the population. But when I see these drug and alcohol rehab centers, they often, and I've heard this, the diet that they put these people on is just more of the same crap. And so you just wonder if you combine it, because I've seen so many people now go on this sort of carnivore diet and they say, oh, by the way, I quit alcohol. Oh, by the way, I gave up smoking. Oh, by the way, I gave up this or that prescription, painkiller or something like that, which I was addicted to. And I don't know, do we know what's going on in the brain? Is there some sort of overlap between addiction, between maybe food physiology and some of these substances? Do you think there's some thought behind that?
Yeah, no. So that was some of the work that I was referring to with Nora Volkow. So so with alcoholism in particular, we have very clear evidence that their brains actually have glucose hypometabolism. That basically all of those years of drinking too much fucked their brain is basically the easiest way to say it. It messed up their brain, and their brain isn't functioning right anymore. And it's having trouble processing glucose as a fuel source, even though some of them can be thin. Most of them aren't diabetic, so you wouldn't know it by just looking at a 24-hour glucose monitoring system. You wouldn't know it by checking a glucose from a finger stick, because you can't really measure what's happening in the brain by doing a finger stick glucose. But so the National Institute of Alcoholism and Alcohol Abuse is actually doing a study right now, an inpatient study of the ketogenic diet for alcoholism. And I think it is, at least in part, because of what you've described, that there are enough anecdotes out there of people who are like, I just went on this diet to try to lose some weight, and oh my God, I overcame my whatever. So I'm actually doing a study of the ketogenic diet for opioid use disorder, the opioid epidemic, at McLean. It's just a small pilot study. And I probably wouldn't have chosen to do it on my own, but I gave a presentation on the ketogenic diet at my hospital, and the addiction people like ran up to me afterward and said, "Shit, you know how to do this diet? Like, we've been trying to get a study going for 2 years." Because again, we understand the science. The science is there. Like, the ketogenic diet might help people with opioid addiction. Like, but we don't know anything about this diet and how to get people to actually do it. And I'm like, well, yeah, no, I know how to do that. So we've been doing that pilot study. Unfortunately, so we got one patient completed before the pandemic began. And I just anecdote. So it's an anecdote because it's only one, but I can tell you, he, one of the things that I'll share with you is that I think when people first start the ketogenic diet, things can get much worse before they get better. I'll put that in. And we saw that with him. But he was inpatient, detoxing, and so he was in a safe environment. And so I'm doing the study in that way because we know that they're in a safe environment. It's highly unlikely that they're going to be able to hurt themselves or do anything. But he definitely got somewhat suicidal. Hard to say whether that was fully the diet, because a lot of people in detox are suicidal because they've messed up their lives and they are in agony withdrawing from their drugs, and so they are often really distraught and sometimes suicidal. But so he went through that in the first week or so. By the end of 4 weeks, he came in almost skipping into my office, just like, "Oh my God, this diet is the best diet ever. I have never felt this good." He's like, "I've been an addict my whole life, and I actually am not craving it at all. I can't believe how good," and he was just profoundly thank you so much for including me in this study. I'm like, "Thank you for doing it." like we needed you to do it. And then unfortunately the pandemic hit and clinical research kind of got shut down for a while, and we're still having trouble getting it back up and running with all of the extra requirements and protective gear and everything needed. So we're hoping to be able to finish that study whenever we can. But yeah, so I think ketogenic diet probably does play a role in addiction, again, at least for some people.
Yeah, and again, I see that with what we're doing, and as you may be aware, we're trying to get a study done on this sort of carnivore population. So we're fundraising, and that's going reasonably well. So hopefully and obviously that pandemic, puts a wrinkle into everything. But hopefully it'll be something that kind of passes by. Hopefully in the near future. So you got that study in progress. Are you finding, you said there's now more and more researchers that are looking into this. What kind of other results have been shown with some of the other research?
In the mental health field, most of it is in, whether you consider Alzheimer's disease a mental health thing or a neurological thing, it's questionable, because the majority of people, almost everybody with Alzheimer's disease, for those of you who don't know, even though we definitely think of it as a serious, legitimate biological brain disorder, there's no question that it is. But almost everybody with Alzheimer's disease, like almost 100% of people with Alzheimer's disease, also have psychiatric symptoms. They almost all have mood problems, anxiety, ruminations. 50% of them, half of them, also have what we call psychosis. They have hallucinations and delusions. And those are the hallmark symptoms of schizophrenia. So if you've ever been around anybody with Alzheimer's disease or ever been to a nursing home, there's a fine line between what we call Alzheimer's and what we call a mental illness. So we've got the most research there. I mentioned the study at Johns Hopkins, which although the researchers were pursuing it, unfortunately it wasn't successful because they couldn't get that many people to do it. There's another group at Wake Forest University that's had pretty good luck at getting people to do the ketogenic diet. They even did some randomized controlled trials where they had people do like an American Heart Association kind of diet, and they definitely showed unequivocal benefits. That the people who got the ketogenic diet not only had improvement in memory and other symptoms, but they also had improvement in biomarkers of Alzheimer's disease. So people are really interested in that. I am aware of 2 studies, one study in the United Kingdom of the ketogenic diet for depression. There's another study getting underway in Canada of, and that's one of the bigwig researchers that I mentioned. He came and gave a presentation, and I talked to him about the ketogenic diet for about 4 minutes. And he was like, started jumping up and down with excitement, like, oh my God, like this, like, you're right, it can do that. Oh my God. And he went home and got a study going on treatment-resistant depression. So they're doing that. There's a group of researchers in Australia that I'm working with, and they have been doing a lot of the research on a mouse model of schizophrenia. They've published about 5 or 6 papers showing that the ketogenic diet improves symptoms of schizophrenia in a mouse model. Those, even though it's mice, those are the same models that are used to develop medications. So if we ever get an FDA-approved new medication, that is the pathway that those meds get developed, is doing these mouse models first. And if it shows a strong signal in that kind of research, then they move to human trials. So they, those researchers want to get a study going for schizophrenia. And so they've asked me to consult to them, I think appropriately recognizing, like, you know how to get people to do this diet. So we understand the science and all that, but you know how to get people to do this diet. So we want you to help us. Tell us what you do. Teach us how to motivate people, coach them. So I'm going to be helping them. And I know there's at least one trial going on at Stanford, ketogenic diet, but they're looking at people with schizophrenia, chronic depression, bipolar disorder, doing the diet, but their primary outcome measures are metabolic. So their primary outcome measures are, can we help people lose weight? Can we improve their diabetes? Which I think they probably will be able to if they can motivate people to do it. But it's at least a start in that direction. So I think there's a lot of interest. It's really interesting because I just gave a presentation not too long ago at one of the traditional Harvard courses to just a group of general psychiatrists. So these are not the low carb, keto, carnivore. They are not the recruited. It's not like going to a low carb USA conference or something where everybody in the audience is already sold. And I gave a presentation on the ketogenic diet, and then I asked everybody at the end, like, how many of you would consider using this treatment right now, here, today? You know, this is an evidence-based treatment for epilepsy. We use those all the time in psychiatry. Would you consider using this for your psychiatric patients? And 70% said yes. So that's really, I think, one of the big things with psychiatry is psychiatrists, we realize we're poisoning our patients with the meds we give them. We also realize that our treatments don't work very well. The overwhelming majority of psychiatrists that I know, they get that. And they are frustrated and heartbroken. They want to see people get better too. So when they hear some reasonable evidence that this may be worth a try, I think they're probably more open-minded than most other medical practitioners. You know, getting the internists or the diabetes specialists to do this for diabetes or weight loss seems like it's an uphill battle, getting them to change their minds and give it a try. But at least in my experience so far, the good news is psychiatrists are pretty open-minded and they're pretty desperate. They're like, yeah, give me anything. Like, Like I'd like to help the people I'm treating.
Let me ask you, because we had an interesting guy, a gastroenterologist from Australia, doing very similar, carnivore ketogenic diet, seeing significant improvements. But like gastroenterology to some degree, I mean, psychiatry, there's a lot of subjectivity in that. And how do you, what kind of tools do you have to measure success? I mean, are there some objective measurements that you can say, I can look at this biomarker or this image, or is it more, we're doing survey data, we're doing, Beck depression indices, or what are the tools that you have to objectively say that person got better? I mean, obviously, when the patients, when I look at patients, I mean, they know when they're better. I mean, they know what they go to the doctor for. And I think we kind of underplay the subjective nature of results because, I mean, this is what people care about generally. I mean, they don't necessarily care that their LDL was, 75 versus 95. They care about, can I get up out of bed tomorrow and smile? I mean, so how are you measuring your results?
So, it's a great question. And, most clinical trials in psychiatry are just based on symptom checklists. So you just ask them about symptoms. Some of them are objective, but most of them are subjective. We just ask them, how are you sleeping? How many hours of sleep are you getting? How's your mood today? And people say what they say. You can, there are some objective markers that you can kind of, you can look sometimes at people and see that they're depressed. I mean, some people who are profoundly depressed, you just look at them and they're depressed. And when they start to get better, you'll see them make better eye contact. They'll lift their head up. They might smile spontaneously. They might be able to crack a joke. Whereas before they couldn't do any of that. I mean, they just looked like they were ready to die. So I'm also working on raising some money for what I hope will be a really compelling research study if we can get it going, where I'm hoping to look at both symptom improvement and ability to function in the world. But at the same time, I'm working with some researchers at McLean. One of the researchers I'm working with at McLean, he is the editor of arguably the #1 psychiatry journal in the world. And he hasn't been doing keto diet. He hasn't been doing diet. He's been doing research for like 30 years. And his research is all about brain metabolism and how it's messed up in people with these disorders. So he has brain scans that kind of measure the abnormalities. And so if we can get our study going, what I'm hoping to do is do these brain scans on people before they start the diet, actually kind of document and measure the metabolic abnormalities in their brain, then put them on the diet for like 8 to 12 weeks, see if their symptoms improve, but then equally importantly, see if their brain scan has changed. Because I think if we can show that their brain scan changed, people will accept that and buy that a lot faster. And we'll look at other biomarkers too. So we know in people with mental disorders, their levels of inflammation are a lot higher. C-reactive protein and other inflammatory markers are usually higher. So we'll measure those. And we'll also just look at the gut microbiome to see if there are any changes. There will be, but it's a hot topic, so people like it. But I think as you and I discussed a little bit ago, it's so complicated and nobody knows how to make sense of it yet. But it wouldn't hurt to document the changes in the gut microbiome.
Do you see, and I know I asked you this previously on another interview, but the rates of mental health disorders, depression and bipolar, anxiety, schizophrenia, whatever, I mean, there's a whole bunch of them. Those are going up and going up significantly. And is that a fair statement to say they've been going up over the last decades? And do we have a thought as to why that is? Can it be diet? Can it be lifestyle? What are your thoughts on why that? Are we just screening for it better? What's the reason for this increase?
So it's a great question. And the research is pretty conclusive at this point. It's not just that we're screening more. It's not just that people are asking the questions. It's the rates are actually dramatically increasing. And So the rates of anxiety disorders are up. The rates of depression depends on what survey you're looking at. So depression is now the leading cause of disability in the United States and in the world. More people are disabled because of depression than any other medical diagnosis. That includes congestive heart failure, cancer, Alzheimer's disease, anything. So mental disorders, broadly speaking, are absolutely the #1 cause of disability. When we look at like rates of bipolar disorder, they're up 40-fold in children and adolescents. That's 4,000% increase. In adults, they've about doubled in the last 20 years. When we look at rates of what's called deaths of despair, that includes suicides, but it also includes overdosing on drugs or alcohol. The deaths of despair are up about twofold, so about twice as many people are dying from that as they did 20 years ago, and that's as a percent of the population. It's not just the strict number. And so there's a lot of controversy about like, why is that? And most people don't think about metabolism. Most people blame it on cell phones, and everybody's glued to a screen these days. Nobody's connecting with each other. The disintegration of the family. People invoke all sorts of reasons, and I think all of those probably do play a legitimate role. But my work is looking at how what we call metabolism is related to what we call mental disorders. And at the same time that mental disorders are skyrocketing, so are the rates of metabolic disorders. Obesity rates are skyrocketing. The rates of prediabetes and diabetes are skyrocketing. People are getting heart attacks and strokes at younger and younger ages, even though they're not dying of them at younger and younger ages, because the medical profession has made advances. We can keep you alive. If you have a heart attack at 40, no problem. We'll put in a stent. We'll do a bypass surgery if we need to. We'll do what we need to keep you alive, and we're pretty good at keeping people alive. So the death rates from cardiovascular disease aren't going up a lot, but the rates of cardiovascular disease are definitely going up astronomically, and people are having those events at younger and younger ages. And so when I look across the population and see that metabolic disorders are rampant, my work kind of suggests an obvious reason, which is, well, if metabolic disorders are related to mental disorders, maybe that's the obvious reason, that as the population is getting more and more overweight, obese, diabetic, all of those things, that maybe their brains aren't working quite right. And that's why we're seeing this increase.
Yeah, I mean, that just sounds so heretical and crazy to think that sick bodies equal sick minds. I mean, it's kind of shocking that we haven't thought of this before. Chris, thank you so much. We've come up on an hour. It seems like we could go for 6 hours. I know we couldn't. We'll have to have you come back on as you get more research. Tell us where people can go to support you in your research efforts. I know you're trying to do some fundraising for that, so that would be great if people can help you out. And then where to find out more about you on social media and so on and so forth.
Great, thank you. The easiest place is just go to my website. So I have a website, Chris Palmer MD, all one word, chrispalmermd.com. If you go there, I've got a lot of the articles and research studies that I've published, and maybe some other people have published. I've got a link to the study that we're hoping to do and an opportunity to contribute if you are able to. And if you want to follow me on any social media, you can find all the social media links there.
Okay, wonderful. Thank you guys very much. I've got to go put a couple steaks in my belly.
Awesome.
You guys have a good day.
Thanks so much.
All right. Thanks so much, Chris, and we'll talk to you later. Okay, take care now. Bye-bye.
All right,
everybody.
thank you.
You guys have a great day. Bye-bye.